My name is Carrie. I'm coming to you from Acacia Demo Group, and we're in England, Colorado. And today I just wanted to tell you a little bit about the difference between bridges and implants. So basically, say you're missing a single tooth. And so you've got this gap here. You've got three different options of what you could do to replace that tooth. You could do a removable partial, which most everybody knows what that is. It is something that you need to take in and out. But there's two other fixed options of the way that you can replace that tooth, and that would be with an implant or with a bridge. To start off with, we'll talk about bridges, and there's some benefits to that and there's some drawbacks. So the first thing is when you're missing one tooth and you're going to do a fixed bridge, you do need to kind of grind down and shape both of the teeth next to it. To illustrate that, we'll just remove those. So now you kind of shape those two teeth down, and what you can do is you can place a fixed bridge, which is all connected. It's one piece, and you just connect it on there and cement it permanently. Once it's cemented on there, you can chew on it like normal. You can brush it like normal. Drawback is you cannot floss it down in between. It's kind of limits you with that. You do need to make sure you are underneath here or use a floss scrubber underneath it to really make sure it gets cleaned out well. Benefit to a bridge is that it takes effect pretty quickly. It usually takes about 2 to 8 weeks to get the finished product. So if you're in a hurry to replace that tooth, that is a benefit. The drawback to it is basically the fate of these three teeth are connected. So if you have, developed a cavity at the back end of one of these teeth, or you get some bone loss or something, when the bridge needs to be replaced, the whole thing has to be replaced. And that does usually cost more than just replacing just a single tooth. So if you just have this tooth here and you've got a cavity on it, you don't need to do one filling. If something happens at the edge, the margin of this bridge, you need to replace the whole bridge, which can be very costly. But another drawback is if you have any bone loss or serious issues with one of these two anchor teeth, for instance, say this one comes out, you have some bone loss and it just pops out, then the whole bridge is lost. So that's the drawback to a bridge. As far as an implant goes, it's the longest lasting restoration that we can place in your mouth. So it is definitely the preferred way to do that. It does take a little bit longer because the bone needs to go around the implant. But once it's done that, it's very stable. You can't get any decay in an implant. You can still get bone loss. So you do need to keep up with your home care and make sure you're keeping it very clean. Basically, we do the surgical placement of the implant, which it goes down into the bone. And then it has to heal for about, it depends on your particular case, usually about 4 to 6 months, sometimes a little faster, to make sure the bone really integrates well around the screws of that implant. And then we place the abutment, which is a small in-between piece, and it goes right in there so that it's good and gives us something to then put the crown on. And then it looks like a regular tooth, and it just slides on there, and once it's cemented on there, it's permanent, and you can chew on it, you can floss it just like normal, you can brush it like normal, so it's very easy to maintain, and it's long lasting. So I hope that explains to you a little bit about the difference between a fixed implant and a 3-unit bridge. And if you have any other questions, please go to our website. It's Acacia Dental Group at acaciadentalgroup.com. And we also have our Google Plus page, so feel free to check it out there. Thanks for listening. Have a great day.